Caddyshack. Your stock just went up. All my stuff, nobody remembers anymore. Okay, a couple things. I'm showing you this. When I had my regular practice, maybe I would see, depends, 25 to, I could see 30, more than 30 in a day, starting really working a long day. Do that time 6 days a week. And this, maybe in my younger days, maybe 2 or 3 times a month, doing it like this. Maybe 2 or 3 times a month, where I felt like I couldn't get it some other way, so I sat them this way. This is the best. This gives you all the advantages for doing a liver lift. And I'm doing liver immobilization all the time. So that tells you that I got some other way to do it that's more easier on my body than this. And I also don't like sitting people up once they're laying down. I put them down, face down, I flip them over like an egg, and then I don't want them to move until it's time to go and pay me. Okay, I don't like get up, sit down, let's do this test, let's do that test. This gives me advantages. This is a perfect way to do it because his liver is sitting down. Okay, so it's pulling pressure against the coronary ligament, the triangular ligaments. Don't you think so, Harry?
Yeah.
Harry, one day you'll be free. You'll be an adult on your own. Your mom will be like, hey, you want to come with me this weekend? You're like, Mom, I got college. I can't come. You'll have an excuse, but now you're stuck. You're stuck with it. You're doing an excellent job. That's the thing.
Thank you.
And you have great hair. I wish I had that much. I never had that much hair. Look at my heyday. I never had that much hair. Now I told Harry it's waving. My hair's waving goodbye. Okay, so here's what I do. I'm going to come. We have all these. If you've done visceral, if you've done it with Parag, you've done it with other people, you've given all these rules. My rules are anatomy. Okay, when we say it's right midclavicular, more or less right midclavicular is going to give me the biggest chunk of the most weight of the liver. If you're a little onto one side or another, it doesn't matter, as long as you understand what it is you're trying to do. So what I'm trying to do is just lift it up. Now, for me to lift this up, I can do this a couple of ways. I can come across, and if I'm doing this with a lady, I am very careful so we all know where my hands are at. Okay? This is midclavicular here, and I'm going to go about 3 fingers below. I'm going to go 3 fingers below because at some point my fingers are they're going to disappear inside. And when I start to pull that skin in, I don't want to be up against his rib cage. So he might feel uncomfortable, but I don't want him to feel uncomfortable because I'm pulling on his ribs. That's the wrong reason to be uncomfortable. He should be uncomfortable because of the fascia. So there's a couple ways I can do it here. I can take my hand, 3 fingers, and I can sit them up straight, big breath in, breath out. As your breath goes out, let yourself fold like a doll. I like to take one hand and force the other hand in. My hands are getting a little weaker as I'm getting older. My hand is like a shelf under there. It is not gripping. If you grip, you're going to start to pull on his rib cage. Again, pain is a weird thing. You say, is that hurting? He might say yes for the wrong reason. And I also want to be able to lift it up as much of the liver as I can, so I want a shelf. With some of the skinnier people in this room, and I'm using 2 fingers. It's really these. You can use whatever fingers you want. I'm using these 2 fingers. It gives me enough lift. Okay, rather than the pinky's not long enough anyway. So I'm using these 2. So here's how we're going to do it. Oh, here's the other thing. Control. Any judo people in the room? Great. Okay. 5 hands. Go on. Can't get it back. In judo, to throw people, I need to grab him so that we're like one person. That's how you throw people. This is the same principle. If you do this antiseptically and you're far away like this, okay, he's holding himself up. That's the problem. Okay, so you need to put your shoulder against him so that he knows I have control of him. He knows that he's not going to fall off the table. In Canada, this was an issue for women. If the therapist's breasts are touching the patient, it's a big problem. And if it's a problem here, I don't know how the rules work. Turn to the side, or turn to another side.
Or put a pillow.
Or put a pillow, or do whatever you got to do. But you have to be touching him, which means his butt has to be sitting at the edge of the table, so he's against my waist. So if there's a big air pocket there, he's going to feel like he's falling. Now, I'll do it again. So take a big breath in, and breath out. Relax, let yourself fall. Look at that hand, just disappear. Get all your depth. Here comes a lift, up and down. Easy. I don't feel really easy on him. 0 restrictions. You should start drinking more.
He's going to know you.
You write me a note.
I can.
He's a
Your license.
I can. I'll get John to co-sign it. We'll spread the malpractice around. Okay. Let me have somebody else. You can be next.
You just got back from Ireland.
Come back.
That's right.
Let's squeeze the Bushmills out of them. Okay. So I'm going to take a couple fingers, big clavicular. It's really these two fingers I'm focusing on. Take a big breath in and breath out. Oh, not the same experience at all. Okay, I got two fingers in there with him. This table's a little high for me. Now, here comes the lift. I'm not curling my fingers. I'm lifting the whole thing up as one unit, one process. Okay? And the act of lifting it changes it. How does that feel?
It's fine.
Nothing. Okay, sit down. Hey. You're all too healthy. Come down to Philadelphia, stop at Pat's Steaks first. That's the first stop, back page. Okay.
Red wine or white?
White. Pinot Verde, young.
Okay, now I'm going to use two fingers on page. That's all I need to do. Take a big breath in, breath out. I'm going to push my fingers all the way back. Here comes the lift. Get a little bit of resistance lifting up, not much. And doing this 2 or 3 times, it'll change. How's that?
A little tender.
A little tender. I mean, on your patients, it'll be much worse. I'm preparing you for the worst, and everybody here is easy. Somebody's got to be bad here. So we'll try it with each other. I'll do it to you so you can see how deep I'm getting in. I'm doing it 2 or 3 times. If you're doing it 5, 6 times, you're a masochist and they're a sadist. Okay? You don't need to do it that much to get change. Hisham, I have a feeling this is not going to be good on you. I don't know why I'm having that feeling, but I'm getting a very strong psychic vibe. Back up to me. Back up to me. Good for you. Okay.
And when you're doing the lift, are you feeling that coming from your legs, from your torso?
I'm going like this, like that.
Right.
If you're doing this, you're going to get tired. And if you get tired, you might start to poke them. I don't want to poke. I just want to carry the whole process up and down.
It's not muscular.
Well, as much as I cannot make it muscular. Take a big breath in, breath out, relax. Hisham is there's a lot of tension up here, a lot of whatever going on.
Intracranial pressure.
Yeah, something. Okay, here we go. Oh, positive toe reaction. There we go. Watch the toes. There we go. Well, I read you like a book. Okay.
So you're doing pretty fast. That lift is pretty quick.
Yeah. Am I saying that there's something horrible wrong with him because he's restricted? No. But you can change that. If I'm doing it because I run along him and I say, well, this area feels tight to me, then I can start to say, what's in this area? Sphincter vodi, gallbladder, hepatic flexure. I can start to think of what structures can I change to change his back. And he is. I mean, he's in good shape. He's a strong guy. But as soon as you hit that, he's got something there. So what does it mean? You can just change it. That's what you can do. Okay, so I want you to try this with a partner. And I'll try it to each one of you so you can see how deep I'm getting in.
It looks like you're moving this weight into you as you're doing the lift. Is that only according to how high the lift is? It's not like you're trying to lift it?
No, I'm not trying to move the patient. Here. Don't start lifting up and then try and go back. No, you feel it. Yeah, me, I felt good. I felt good during the whole process. Okay.
Should you go too far posterior? Is there anything that would stop you from going? Or
Yeah, spine.
okay.
Spine in the back of the table. Okay, I am going to go as far back. If you're starting to feel a pulse from the aorta, that's good. If you don't feel a pulse, that's probably a worse sign.
Okay.
You know, that they're dead. So I'm joking, but not joking. You need to go far back. There's nothing light about this. If you go superficial, you're not going to lift the liver. You're just going to go under the rib cage, slip under the rib cage. It'll be just as painful, and for no benefit, little benefit. Okay, now I'm going to use 2 fingers. Actually, I'm just going to do this one-handed. Okay, take a big breath in, breath out, relax. Slow on, slow off. Deep?
Yeah, I mean, it felt pretty good, and I have shoulder issues, and the first one I felt it up in here.
You have issues.
Issues.
Issues. Okay, we'll talk about those issues.
Size wise, on the short side.
Put them in a chair. And I got a lot of patients that are, you know, Bob's big boy breakfast kind of patients, you know, 300 pounders. You can't do it. You can't. I can't get my arms around them. So I don't worry if I can't do the technique. I find something else to do. Okay, so if you can't, you can put them in a chair to do this also. Okay, come back a little bit more. Come back a little bit more. Okay. Now take a big breath in. Okay, breath in, breath out. Relax, relax, relax. When you say relax, he won't. So you got to go like that. Relax. Okay. Here it comes. He's not going to like this. Up and out. I'll let him catch his breath. Uncomfortable but doable, right? And not uncomfortable. Your ribs don't feel uncomfortable, correct?
No.
Okay. You can give me the truth. I can handle it. I can handle it.
Muscle.
Whoever wants me to do it, just come up here and I'll do it. And I want you to try it with your partners. You have to. They have to be sitting back against you. Her rib cage is sitting right on me, so I'm going to use just 2 fingers. Here we go. And down. Up.
I mean, it looks like that from out here, like there's more.
It's better if you get this kind of view. Come in. Yeah. Okay, sit up straight. He's not easy at all. I'd like to go deeper than I'm getting, but I'm not going to get it here because my hand's still getting a little too weak.
You angry, right? Get some wood there.
Big breath in, breath out, relax. And she's not consciously fighting me, but she's fighting me.
Psychically.
Yeah, this is as far as she's going to let me. There we go. One. Here comes another one. Okay? Yeah, I got plenty. Got a lot of them. Mr. T, Rocky 3, the greatest Rocky movie ever. When he comes out, he says, I got a lot of mo for you. That's back when I was running the karate studio when I was in shape. I was training guys who were fighting at the casinos. We knew the lines by heart. Now I know the lines by heart. I just got the body of a fatso. Big breath in.
I'm getting even pain right there.
All right.
Going up into.
Is it tolerable? She tells me she gets a pain. I'm not going to fly out. When somebody tells you they get a pain, don't panic and do that. Because even if you're not going to do this technique or it's not going to work this way on her, you start sending a signal now. If you start getting panicky, that like you don't know what's happening. So I just stop where I'm at and I go, is this okay? She says, it's not okay. If she's got to think about it, the answer is no.
Right.
Okay? So let me just start again. Stay there.
Okay.
I'm going to start lighter. Okay? Okay, take a deep breath. Breath out, I'm going to go slow. You let me know what's too much. I'm going to watch this hand. If this hand goes up, I'll stop. Okay, here comes the lift. Positive toe sign. Comes another lift. Okay. Maybe I went a little too fast before. Okay, big breath in. Breath out. So fall forward. Okay, here comes lift. Small one.
Yeah.
If you have your choice, get all. If you have your, you'll be okay.
She said, yeah.
Probably. If you have your choice, get all your depth before you lift. Don't start to lift and then go deep.
When you're getting your depth while she's exhaling.
I try to. It'll be okay. Most likely. Big breath in. Breath out. Easy. Yeah, when I've had this done to me, I have the same reaction that she's having. There's some pain I hit, I can't get past it. There's a limited amount you can do it on me. Sit up straight. Big breath in, breath out. He's like a rock. I'm getting nowhere. When I say rock, if I start feeling the muscles pushing me out or something else going on in him, comes a lift. Yeah, I'm not getting very deep at all. I'm getting a little bit on him.
There's a little pain too.
Huh?
A little bit of pain too.
I had no pain.
You know pain?
Yeah, I enjoyed it.
I have a question.
Yeah, back up.
For conditions of hepatitis C, hepatitis C, is it
I'm doing it to them, but there's easier ways to do this. This is the most difficult way to do it. So if you're worried about whether or not you use heavy pressure in your liver, use moderate pressure, use mild pressure. Don't do this technique. You have lots of choices. But I am doing it to people. Hepatitis C is very common now.
Before you say you got you still keep doing a couple of times?
I try to get a couple reps out of it once I've had to fight to get my space. Take a big breath in. Her rib cage is sitting right against me. It's difficult. Breath out. I can only use my fingers. Her rib cage is sitting right on me. Here comes a lift. Second one. Did you guys go?
Starting on page 7, trying to get more topics.
Huh? Soon. Air conditioning, something. That fan's like spiritual. I don't know what it's actually doing. It's just kind of like. Big breath in. Breath out. Here comes the lift. Try it with a partner.
For a short person, do you have them sit on a chair?
Put them in a chair. Yeah. Or, as I said, there's a lot of other ways to do this. Many other ways. I'm going to show you much easier ways. Sit up straight. Big breath in. Breath out.
It's not an MMA move.
Yeah.
It's fine.
Try with a partner. Huh? Oh, I can do it.
We can do it together.
You want to do me?
Yeah. I got one more.
One more?
Huh?
Is that resisting you?
No. Good.
Liver lift.